हाँ जी कर दो.
We are live now, ma'am.
Good evening, students. Welcome to this session, which is especially for first year students, and we will be taking the topics in detail. Today, we are going to take glycolysis and TCA. Obviously, the link between glycolysis and TCA, that is link reaction, that will also be taken in today's topic. So let's start. And I will be actively looking at the chat box in the YouTube session. In YouTube Live. Yes, Dr. Vansh, good evening. I am fine, dear. How are you? So nice to be with first year students. Usually we teach NEET and FMG students. So and many students when they read this kind of conceptual biochemistry classes, then many students approach me कि मैम आप फर्स्ट ईयर में क्यों नहीं मिले. So that's why I always say that start reading in first year only. Am I audible?
Yes, ma'am.
My screen is stuck. Is it stuck only for me or you also?
Yes, ma'am. It's stuck.
My internet is fine.
Ma'am, please rejoin.
हाँ अभी मेरा हैंग हो गया है.
जी. Okay.
Hanji Shubham, I'm ready.
Okay, ma'am.
Let me know when we're live.
Yeah, we are live, ma'am.
Okay. Sorry for the inconvenience, students. We are back after the technical error. So I was telling you that when we teach NEET and FMD students, they have pressure of the exam, so they have to study 19 subjects thoroughly at that time. So they approach us and they study with us. And many a times after reading this kind of conceptual biochemistry, I am approached by students asking that मैम आप पहले क्यों नहीं मिले, मैम ऐसी बायोकेमिस्ट्री पहले फर्स्ट ईयर में क्यों नहीं की, that why we haven't done this way of biochemistry in first year only, because if you read the concepts in first year only, this is gonna help you in so many clinical subjects, and we are gonna do diseases also, right? So tomorrow's session will be on diseases, but today's session is from core biochemistry, that is glycolysis and TCA. So it is very nice for me to interact with first year students here. So can you tell me how many are first year students here? Can you tell me in the YouTube chat? I would like to know that how many young students are here with us, because this session we have conducted actually for first year students. So actually we have first year students or not? Do let me know in the chat box. Okay, so I'm continuing. I'm starting the topic. There's a little lag between when I am speaking and you send me messages. So I get a lag of one minute, I think. So, okay, by the time messages are reaching me, so I will start the topic of glycolysis. So glycolysis is the main pathway of oxidation of glucose. Most of the cells of our body, they use glucose as the main energy source, especially RBCs and brain. Glucose is very, very important for them. They cannot use other things, like brain cannot use fatty acids. RBCs can only use glucose, whether it is fed state, fasting state, or starvation state. Okay, so glycolysis is very, very important for human body or for any cell, I will say, right? So this pathway from core biochemistry is very important for you to understand the basics. So what is this? In glycolysis, glucose, we are going to break down glucose to get energy. But this compound is not having energy. What is the basic concept of energy? Energy can neither be created nor be destroyed. It can just be converted from one form to another, right? You remember this? So we're not going to create energy here. We're just going to convert one form of energy to another. So how one form of energy is converted to another here? First, phosphate is added, right? Phosphate is a high energy bond. First, we will add phosphate high energy bond. Then we will break this phosphate high energy bond. When we break high energy bond, then energy is released, right? Energy is released, and that will be trapped in the form of ATP, right? Just one form of energy is converted to another form. So first, chemical form of energy of ATP is used. But the way this whole pathway is planned, that will tell that more energy is gained as compared to how many is used. So see this, what is happening, that in glycolysis, glucose is the starting material, obviously. One glucose, which is obviously we all know it is 6-carbon compound, it gets converted to 3-carbon pyruvate. So obviously we'll get 2 molecules of pyruvate. There's a request from Dr. Sharif. He's saying cancer cells also, ma'am. So yes, there is Warburg effect in cancerous cells. Once you understand this glycolysis and TCA, only then I will be able to teach you Warburg's effect, and that is very important. Good topic, Dr. Sharif. Okay, Owen, thanks for the comment that I am your favorite. Okay, so let's continue. So I was telling that one molecule of glucose, 6 carbon, gets converted to 2 molecules of pyruvate because pyruvate is 3 carbon. It is very important that you know the number of carbons in some compounds, because this way the topic will be easy for you, right? You don't have to cram that we're getting 2 pyruvate. It is that you are getting 2 pyruvate because it is 3 carbon molecule, okay? So what is happening? There are 2 phases of glycolysis. Phase 1, total 10 steps, 5 steps in phase 1, which is energy investment phase. Here, 2 ATPs are used. 2 ATPs used. On the other hand, phase 2, another 5 steps in phase 2, that is energy generating phase. So here ATPs are produced. But tell me, glycolysis is finally going to give energy. Then why are we using ATP at the very first step now? What is the first step of glycolysis? Glucose gets converted to glucose 6-phosphate and ATP is used. Can you tell me why this opposite thing we're doing? We are going to get energy. We want energy, but we're using energy at the very first step. Why? Thanks for the appreciation comments, dear students. Yes, biochemistry is easy. We only find it difficult when we try to cram it. But when we are doing it with concepts and with story form, like glycolysis is my favorite topic to teach, because this is such a beautiful concept. It's a plan of business that first we are investing, only then we'll be able to gain out of it. The best plan made by nature. It's so beautiful to understand. So the first step of glycolysis is hexokinase or glucokinase, where ATP is used. So this is a kind of plan of business that first ATP is used and then ATP will be produced. So any good business is that where we invest less and we obtain more, right now? We invest less and obtain more. So ऐसा प्लान कैसे बनाया जाए, ये स्मार्टनेस हमें देखनी है ग्लाइकोलिसिस में. तो हमें सिर्फ देखना है कि नेचर ने कैसे बनाया. डोंट टेक इट एज अ बर्डन कि हम पढ़ रहे हैं या हमें इट्स लाइक अ स्टोरी ना. So when it is like a story, then it is interesting. Okay, so when in your mind you think like that कि मुझे स्टोरी सुननी है, तो पढ़ने का बर्डन नहीं लगता है. Okay, so we'll do that way. So देखो, पहले एक ATP, first one ATP is added. One ATP is used. Why we are using ATP? Because phosphate is a high energy bond. We cannot add phosphate in a compound without using ATP. So we have to use ATP here, right? So ATP use kiya, one ATP used at hexokinase or glucokinase enzyme. So we get glucose 6-phosphate. Then glucose 6-phosphate is converted to fructose 6-phosphate. As glucose and fructose are isomers, so enzyme is isomerase. Okay. Okay, then third step is fructose 6-phosphate. Here also we need to add one more ATP. So already 6th number phosphate is having ATP. 6 number पे phosphate already लगा हुआ है. Sorry, not ATP but phosphate. 6 number पे phosphate already लगा हुआ है. So we are adding phosphate at number 1 position also. So we get fructose 1,6-bisphosphate. Fructose 1,6-bisphosphate, right? And the enzyme is phosphofructokinase. So this enzyme is also using one ATP, right? So how many ATPs are used till now? 2 ATPs are used. One at hexokinase, other at phosphofructokinase 1. That is PFK1, right? Then we get fructose 1,6-bisphosphate. It's a 6-carbon compound. It is a 6-carbon compound with 2 phosphates. at number 1 position and number 6 position. Both extremes have phosphate now. So now you break it in middle, break this compound in the middle. So what you will get? You will get 3 carbon here and 3 carbon compound here. Both are having 1,1 phosphate. So we get keto form dihydroxyacetone phosphate. We get aldehyde form glyceraldehyde 3-phosphate, right? The enzyme is aldolase A. Now, DHAP, dihydroxyacetone phosphate, also gets converted to glyceraldehyde 3-phosphate by enzyme isomerase. Okay, so this is phase 1 of glycolysis. 2 ATPs are used. So we have got 2 molecules of glyceraldehyde 3-phosphate by now. Now 2 molecules will be entering phase 2. So can you see here what is happening? Let me rub all this. 1 molecule is entering phase 1 and ATP is used. 2 molecules of glyceraldehyde 3-phosphate are entering, 2 molecules are entering phase 2, and that is energy producing phase. So anything which is used in phase 1, that is only 1 at each step. But anything which is produced at phase 2 will be multiplied by 2. Wow, such a beautiful thing. Anything which will be produced in phase 2 will be multiplied by 2. So that's why this breakage of aldolase A happened now. So ask reason at every step, why every step is occurring, why next step is occurring. So aldolase A has broken fructose 1,6-bisphosphate, the 6 carbon compound, so that for entering into phase 2, we get 2 molecules. And these are 2 molecules of glyceraldehyde 3-phosphate. Yes, Lakshmi, fructose and glucose are functional isomers. Very good. You have read isomerism topic. Very good. Okay. So next step, let me rub all this so that you can focus on this next step. So this next step is glyceraldehyde 3-phosphate dehydrogenase step. This image is not very clear. I just checked it. So sorry for this. But it is very difficult to have this big pathway glycolysis on one single page. So yeah, today's session is short, so I'm not taking every step on a different page, so that we are able to cover the 3 topics in today's class. But I don't think I will be able to complete. Okay, so let's see. So glyceraldehyde 3-phosphate gets converted to 1,3-bisphosphoglycerate. So glyceraldehyde 3-phosphate gets converted to 1,3-bisphosphoglycerate. Here we are adding 1 more phosphate. So I told you to add phosphate, we have to use ATP. But this step is not using ATP. This step is using inorganic phosphate. When we write PI, remember? PI is inorganic phosphate. So this step is using inorganic phosphate. This step is not using ATP to add phosphate, which is a very, very special thing. So they ask you question that which enzyme of glycolysis can use inorganic phosphate? That's a very big thing, very special thing, very rare thing. Okay. So this is the master plan of our business, I can say. This is the master plan of business, that glyceraldehyde 3-phosphate dehydrogenase enzyme is not using ATP. It is using inorganic phosphate and adding phosphate in a compound. And this enzyme makes NADH because it is a dehydrogenase. Dehydrogenase means there is removal of hydrogen from the substrate. So this hydrogen is given to NAD, making NADH. So NADH will later go into ETC to give ATPs. Wow. This is our master plan, master step of the business, that 5 ATPs are produced because 2 NADH will give 5 ATPs here. So ATP is not used, but ATP is produced. Okay. The next is 1,3-bisphosphoglycerate gets converted to 3-phosphoglycerate. 1,3-bisphosphoglycerate gets converted to 3-phosphoglycerate by removal of number 1 phosphate, right? You can guess what is happening. 1,3 gets converted to 3-phosphoglycerate. There is removal of 1 phosphate from number 1 position. That is taken by ADP and ATP is formed. This ATP formation at the substrate level is called substrate level phosphorylation. We have ETC which is called oxidative phosphorylation, and this is substrate level phosphorylation. Okay. So the enzyme is PG kinase. PG kinase. It is very important to learn the enzymes of substrate level phosphorylation. Okay. Then next is mutase enzyme, 3-phosphoglycerate gets converted to 2-phosphoglycerate. And then enol bond is created by enolase enzyme. And then pyruvate kinase will form pyruvate. The last phosphate is broken by pyruvate kinase, and this phosphate is also incorporated into ATP. So the end product is pyruvate. And in case of anaerobic glycolysis, pyruvate gets converted to lactate. Pyruvate kinase is also substrate level phosphorylation step. It is also the irreversible step of glycolysis. So we have 3 irreversible or regulatory steps in glycolysis. This is very, very important and frequently asked, whether it is theory exam or MCQ. So these are hexokinase, which uses ATPs, PFK1, which uses ATP, and pyruvate kinase, which is the last enzyme which produces ATP. It is substrate level phosphorylation enzyme also. So we have 2 substrate level phosphorylation enzymes, SLP enzymes, PG kinase, phosphoglycerate kinase, and pyruvate kinase, right? So now, question is asked on pyruvate kinase deficiency. In pyruvate kinase deficiency, it is the second most common human enzyme deficiency. Which is first most common? Can anyone tell me which is first most common human enzyme deficiency? Okay, I'll tell you. G6PD deficiency, which is enzyme of HMP pathway. Glycolysis is enzyme, pyruvate kinase is enzyme of glycolysis pathway. This pyruvate kinase deficiency leads to hemolysis, and G6PD deficiency also leads to hemolysis. So both these conditions are very common, and in both cases, hemolysis occur. So how will you distinguish them? You will distinguish them with the presence of Heinz bodies. Heinz bodies are only found in G6PD deficiency. So this is very, very important question, pyruvate kinase and G6PD deficiency. So let's revise. First most common human enzyme deficiency is G6PD deficiency, which is enzyme of rate limiting enzyme of HMP pathway. And this deficiency causes hemolysis plus Heinz bodies are found. But in pyruvate kinase deficiency, which is second most common human enzyme deficiency, glycolysis pathway, it is not the rate limiting, it is the last enzyme or substrate level phosphorylation enzyme of glycolysis. And this also leads to hemolysis, but no Heinz bodies. This way you can differentiate. Okay. Then coming to energetics of glycolysis. So glucose gets converted to 2 molecules of pyruvate. Here, minus 2 ATPs, one at hexokinase and one at PFK1, minus 2 ATPs. So on left side, I'm writing ATPs. Why I'm writing ATPs on left hand side, you will understand soon. And the way I'm writing, you should also revise and take notes in this way only. So minus 2 ATP because 1 ATP used at hexokinase, other ATP used at PFK1, and plus 4 ATP 4 ATPs formed at substrate level phosphorylation steps. Okay, which two enzymes? PG kinase and pyruvate kinase. And 2 NADH formed. 2 NAD gets converted to 2 NADH. At which step? Glyceraldehyde 3-phosphate dehydrogenase step, the master plan of our business, which I told you. Okay. So these 2 NADH will go into ETC and will give 5 ATPs, right? So total is 5 plus 4, 9, 9 minus 2, that is 7 ATP in case of aerobic glycolysis. Okay, so 5 plus 4, 9 minus 2, 7 ATPs in case of aerobic glycolysis. In case of anaerobic, 2 lactate are formed from pyruvate. Enzyme is lactate dehydrogenase. This enzyme converts NADH to NAD. So the NADH, which was produced earlier, that is converted back to NAD. So this NAD will be reused, and these 5 ATPs will not be produced because we do not have NADH now. So now energetics is 4 minus 2. Only this 4 minus 2. So that is 2 ATP in case of anaerobic. 2 ATP in case of anaerobic, right? 7 ATPs in case of aerobic. Now they ask you a question, number of ATP produced in RBC in aerobic state. Try telling me the answer. Okay, so there are 2 doubts. Why hemolysis occur? I'll answer that. And what is the rate limiting enzyme of glycolysis? I'll tell that. First, let's do this one. Number of ATP produced in RBC in aerobic state. What will you mark? What is the answer? Okay, Shreya is saying 0. 0 is not the answer. Answer is 2 ATP. 2 ATP, whether they say aerobic state or anaerobic state or fed state or fasting state. Answer is 2 ATP because there is no mitochondria in RBCs. We know that mature RBCs do not have mitochondria. Yes, Lakshmi, you are right. Answer is 2. So RBCs do not have mitochondria. So ETC cannot occur in RBCs. So the 5 ATPs which were coming from ETC, they will not be coming. Energetics is only 4 minus 2. But in case of RL shunt, Rappaport-Lubering shunt, one substrate level step will not occur. So energetics is 2 minus 2, that is 0. In case of RL shunt, one of the substrate level phosphorylation step is not occurring. This 4 ATP was coming from 2 substrate level phosphorylation steps. When only one substrate level phosphorylation step is occurring, means only 2 ATPs are produced through substrate level phosphorylation. So in case of RL shunt, 2 minus 2 is 0. So in case of RBCs, 90% of glucose is giving 2 ATP per glucose, but 10% of glucose is going towards RL shunt and it will give 0 ATP. Let me take a blank paper. So in case of RBC, 90% glucose will go into normal glycolysis to give 2 ATP per glucose. But a minor percentage, approximately 10% of glucose, will go into RL shunt where no ATP is formed, but 2,3-BPG is formed. Because in RBCs, this compound 2,3-BPG is important for release of oxygen at tissue level. Okay. So I repeat, in RBCs, 90% glucose will be giving 2 ATP per glucose, will be going into normal glycolysis, but 10% glucose will be going towards RL shunt, where the purpose of glucose is not the production of ATP, but the production of 2,3-bisphosphoglycerate. Okay. Okay, next, let's do this question. In order to keep ion gradients across their membrane, RBCs need ATP. RBCs will enlarge and burst in the absence of these ion gradients, resulting in hemolytic anemia, mainly due to inhibition of which of the following process? Tell me the answer. So yeah, answer is substrate level phosphorylation. TCA will not occur. Oxidative phosphorylation or ETC will not occur in RBCs. Oxidation of glucose to carbon dioxide and water also occur in mitochondria. So the pathways which occur in mitochondria, they will obviously not occur in RBCs. And the main source of energy in RBCs, 4 minus 2, this 4 is what? Substrate level phosphorylation ATPs in phase 2. So very good. Answer is B. Lakshmi and Shreya, very good. So then coming to link reaction. So glycolysis occurs in cytoplasm and link reaction will occur in mitochondria. So via glycolysis, glucose has formed pyruvate. So this pyruvate needs to go inside the mitochondria, but it has to cross inner mitochondrial membrane. So here we have pyruvate proton symport. This is also a frequently asked question, that how pyruvate enters mitochondria. It goes with pyruvate proton symport, right? So glycolysis I have taken in short due to the limitation of this session, right? So otherwise for UGs, we have to do glycolysis in detail. 10 marks question can come on glycolysis, right? So in glycolysis, glucose forms pyruvate and then pyruvate goes to mitochondria. In mitochondria, this 3-carbon pyruvate gets converted to 2-carbon acetyl-CoA. 2-carbon acetyl-CoA. So here there is removal of carbon dioxide, obviously. 3-carbon to 2-carbon, removal of carbon dioxide. And we know the name of link reaction enzyme is pyruvate dehydrogenase complex. It is pyruvate dehydrogenase complex. Because it is dehydrogenase, so dehydrogenase means oxidation is occurring and carbon dioxide removal also occurring. This is oxidative decarboxylation step. This is oxidative decarboxylation step. In TCA also, we have 2 such steps of oxidative decarboxylation, right? For oxidative decarboxylations, coenzyme is vitamin B1. Coenzyme is vitamin B1. And because it is dehydrogenase, so NADH is produced here, right? NADH is also produced here. Link reaction is irreversible. Link reaction is irreversible. This enzyme link reaction has 3 components, E1, E2, E3, because it's a very big complex enzyme. So we can learn the 3 components. E1 is, as the name of enzyme, pyruvate dehydrogenase only. E2 and E3 are dihydrolipoyl. So E2 is dihydrolipoyl transacetylase. E3 is dihydrolipoyl dehydrogenase. Okay. So link reaction is irreversible. What this means? This means that pyruvate can form acetyl-CoA, but acetyl-CoA can never form pyruvate. Now, pyruvate is coming from carbohydrates. Acetyl-CoA is mainly forming fats in body. So carbohydrates can be converted to fats. Carbohydrates can be converted to fats. Excess carbohydrates in body will always get converted to fat. Some people will do dieting. They think we are fatty, so they'll stop the fat intake in the body. But they will take excess carbohydrates. And they're unable to lose weight because excess carbohydrates will always be converted to fat in body because of this link reaction happening, right? And because it is irreversible, so fats cannot be converted to carbohydrates. Fats cannot be converted to carbohydrates. We have only two exceptions here, glycerol and propionic acid. Glycerol and propionic acid. There were two doubts from students. One was, what is the rate limiting enzyme of glycolysis? Rate limiting enzyme of glycolysis. In some books, it is written hexokinase, but that is wrong. Rate limiting enzyme is PFK1. Okay, do remember this point. PFK1 is the rate limiting enzyme of glycolysis according to your latest standard books. Then another doubt was why hemolysis occurs. There are different reasons why hemolysis occurs in pyruvate kinase deficiency and why hemolysis occurs in G6PD deficiency. So let's first take for pyruvate kinase. Hemolysis occurs in pyruvate kinase deficiency because when pyruvate kinase is not there, then RBCs cannot use glucose. And I told you, whether it is fed state, fasting state, or starvation state, the fuel is only glucose for RBCs. I repeat, fuel is only glucose for RBCs. So when glucose is unable to give energy, then the cell which is first affected in body is RBCs because they cannot use any other thing. Okay. For example, muscle cell will start using fats, right? Muscle cell can use fatty acids when glucose is not available, but RBC cannot use fatty acid. Okay. RBC cannot use any other fuel. So RBCs will be affected. Lack of ATP in RBC will lead to the damage to the membrane of RBC, right? Sodium, potassium, ATPase pump will be affected and damage to the membrane. So hemolysis in pyruvate kinase deficiency. In G6PD deficiency, G6PD regularly destroys H2O2 of RBCs. G6PD regularly destroy H2O2 of RBC. So G6PD, when it is not there, then this free radical H2O2 will accumulate. So too much of this free radical will damage, oxidative damage will happen to the RBC membrane and therefore hemolysis will occur, right? Okay. Then one more clinical concept. Next, in link reaction, continuing in link reaction, there's one more concept that multivitamins are given in lethargy. If some patient is complaining that बहुत दर्द हो रही है, थकान रहती है, डॉक्टर साहब, so हम क्या करते हैं? हम multivitamins prescribe करते हैं. We prescribe multivitamins when patient is complaining of lethargy. And even when we are also feeling less energy during our days, then we will take multivitamins. Why? What is the reason? Can anyone tell me the reason? Everybody these days know that energy kam hai to vitamins le lo. What is the relationship between vitamins and energy? Okay, you will get to understand from this line 5 coenzymes are required. 5 coenzymes are required for link reaction and TCA. Link reaction and TCA are giving a lot of energy. And these 5 coenzymes are vitamin B1, B2, B3, B5. that is thiamine, riboflavin, niacin, and pantothenic acid. And one more is lipoic acid. So can you see, out of these 5 coenzymes, 4 are vitamins, B complex vitamins. So mainly for energy, B complex vitamins are prescribed, because whenever lethargic feeling is there, then the first most probable diagnosis is deficiency in B complex vitamins. Because if B complex vitamins are deficient, then link reaction and TCA are unable to give the huge amount of energy they usually give. Right? Yes, very good, Lakshmi. It is, the reason is coenzyme. Okay. Next. So solve this question. A female neonate born full term who is failing to thrive and not gaining weight is brought to a pediatrician by her parents. Physical examination showed small head hypotonia, low muscle mass. Blood examination showed metabolic acidosis with highly elevated levels of pyruvate, lactate, and alanine. A 6-month history also revealed persistent acidosis, which did not go away with thiamine supplementation. The enzyme most likely deficient in this patient is Can anyone tell me the answer? So yeah, this is a case of PDH deficiency, pyruvate dehydrogenase complex deficiency or defect. So what happens by this PDH enzyme, which requires B1 as it is oxidative decarboxylation? Yes, very good, Lakshmi. You're mostly giving correct answers. Very good, Varun. So pyruvate gets converted to acetyl-CoA by link reaction by PDH enzyme. But if this enzyme is not working, then there will be excess pyruvate. Excess pyruvate will be converted to excess lactate and alanine. Okay, pyruvate gets converted to alanine also. By which enzyme? SGPT enzyme. So you can revise SGOT, SGPT enzymes also. See, whenever you study, you have to integrate it with so many subjects, so many topics. So many topics, so many subjects are interrelated. After all, the body is not divided into 19 subjects. It is just the way we study. But finally, integration is required. Okay. So keep doing this integration since the very beginning. Since your first year only, you should keep doing the integration, so that by the end of these 5 years, you have so many things integrated and you are a complete clinically oriented doctor who can relate so many things in his mind, in his or her mind, and can diagnose and treat the patient. So you really need a lot of knowledge. So pyruvate will be in excess, lactate will be in excess. That was the question, right? There is excess pyruvate, lactate, and alanine. Metabolic acidosis because of lactic acidosis. Patient has lactic acidosis, right? So they clearly mentioned that it is not B1 deficiency, right? The symptoms did not go away with thiamine supplementation. So answer is, can you tell me what is thiamine and what is thymine? There is one thiamine, THIA. The other is thymine, THYMINE. What are these? Lakshmi, I did not get your question. What is your doubt? Let me read it. Ma'am, so if any enzyme of glycolysis is defect, glycolysis occurs. Okay, you want to say hemolysis occurs. Yes, if any enzyme of glycolysis will be defective, then hemolysis will occur. But the enzyme deficiency of pyruvate kinase is common. Others are not common. Those gene defects are not common. Okay. Yes, Lakshmi, very good. THIA thiamine is vitamin B1. This is vitamin B1. And what is this THY? This is pyrimidine, thymine, uracil. Okay, these are pyrimidines. Uracil, cytosine, these are pyrimidines. So THY is pyrimidine. How will you learn this? Y is here and Y is here. Y is here in pyrimidine, Y is here in thymine. Okay, THY. So next is TCA cycle. For understanding TCA, you need to know a few concepts. What is malonate and what is malate? I told you that number of carbons you should be knowing. It is very, very important. Malonate, जिसमें N आ जाए, the one with N, it is a 3-carbon compound. However, malate is a 4-carbon compound. This malate is intermediate of TCA, but malonate is inhibitor of TCA. Right? So be careful, malonate or malonyl-CoA. Then I'll help you learn one thing. What is glutarate and what is glutamate? What is the difference between glutarate and glutamate? Teju is saying that thymine is nucleotide. No, it is not a nucleotide. It's a pyrimidine. There's a difference between nucleotide and pyrimidine. Pyrimidine is a nitrogenous base and nucleotides have 3 components: nitrogenous base, sugar, and phosphate. Okay. So nucleotide, nucleoside, nucleic acid, you need to be very clear with the basic terminologies, right? So coming back to where we were, glutarate, glutamate, and glutamine. So we know that in TCA there is alpha-ketoglutarate. So if you add one amino group in alpha-ketoglutarate, you will get glutamate. You add one more amino group, you will get glutamine. So easy to learn this way. All these have 5 carbons. All these have 5 carbons. So alpha-ketoglutarate has 5 carbon and no nitrogen. Glutamate has 5 carbon and 1 nitrogen. Glutamine has 5 carbon and 2 nitrogens. Then oxaloacetate, similarly, oxaloacetate gets converted to aspartate and asparagine. Keep on adding amino group towards the right side. So this way it is very easy to learn. And all these compounds are 4 carbons. All these are 4 carbons. Then I'm just going to take few important points in TCA cycle. So thiokinase is the substrate level phosphorylation step of TCA. Substrate level phosphorylation step of TCA. This thiokinase produces ATP or GTP. In books, mostly they write GTP, but in your latest edition of Harper, they have written ATP because mostly this enzyme produces ATP. Mostly this enzyme produces ATP. So in short, we can say thiokinase produces ATP. But thiokinase in liver and kidney, it will produce GTP during fasting or starvation. Because during fasting or starvation, gluconeogenesis occurs and gluconeogenesis requires GTP. Can anyone tell me which enzyme of gluconeogenesis requires GTP? I repeat, thiokinase normally produces ATP most of the time it will produce ATP. But thiokinase in liver and kidney during fasting or starvation will produce GTP for gluconeogenesis pathway, because gluconeogenesis pathway requires GTP. Which enzyme? PEP-CK, phosphoenol pyruvate carboxykinase of gluconeogenesis, requires GTP, right? Then all enzymes of TCA lie in mitochondrial matrix except succinate dehydrogenase, which lies in inner mitochondrial membrane. Yes, very good, Lakshmi. Gluconeogenesis, PEP-CK enzyme requires GTP. Very good. You're well read, Lakshmi. Keep going like this. You will rock. So I was telling that all enzymes in mitochondrial matrix, except succinate dehydrogenase, they're present in mitochondrial matrix, but succinate dehydrogenase is present in inner mitochondrial membrane. Okay. Then let's do complete breakdown or oxidation of glucose from glycolysis, link reaction, and TCA all. So glucose gets converted to 2-pyruvate, and here I already told you 7 ATPs. 2-pyruvate get converted to 2-acetyl-CoA, and here we get 2 NADH. 2 NADH will give 5 ATPs. Then 2-acetyl-CoA enters TCA cycle. For 1-acetyl-CoA, 3 NADH, 1 FADH2, and 1 ATP at substrate level phosphorylation step. Which step? Thiokinase step. 3 NADH in TCA are formed at which step? Isocitrate dehydrogenase, alpha-ketoglutarate dehydrogenase, and malate dehydrogenase. FADH2 is produced at which step? Succinate dehydrogenase. Okay. So this is equal to 7.5, this is 1.5, and this is 1. This is from 1-acetyl-CoA. So from 1-acetyl-CoA, it is 10 ATPs. From 1-acetyl-CoA, it is 10 ATPs. From 2-acetyl-CoA, it will be 20 ATPs. 7, 5, and 20 will be 32 ATP per glucose on complete breakdown or complete oxidation. So Varun said it is phosphatase. No, Varun, it is not phosphatase, dear. It is the glucose-6-phosphatase enzyme of gluconeogenesis that is absent in von Gog's disease, that is present in endoplasmic reticulum, and that enzyme does not require GTP. Okay, that is not present in muscles and it is present in liver. So all these important points about glucose-6-phosphatase are very, very high yielding and frequently asked. So now one student doubt was there on Warburg effect. So I'll tell you Warburg effect on this page. You can first solve this question. Thiokinase of TCA produces. What will you mark? So Pasteur effect. Pasteur effect occur in normal cells of the body. It says that if oxygen is present, anaerobic glycolysis will be inhibited. Anaerobic glycolysis will be inhibited because if oxygen is present, then one glucose can give 32 ATPs. If oxygen present, one glucose can give 32 ATPs. In anaerobic, only 2 ATPs are derived. So why to waste glucose, right? Therefore, any normal cell, if oxygen is present in any normal cell, anaerobic glycolysis will be inhibited. What is Warburg effect? Warburg effect occurs in cancerous cells. It occurs in cancerous cells. It is opposite from Pasteur effect. It says that even if oxygen is present or not present, be it any situation, glucose always form lactate. Glucose always form lactate. And in the presence of oxygen, this kind of glycolysis occurs. This is known as aerobic glycolysis. But this glucose will not go into ETC. ETC is called oxidative phosphorylation. So in short, Warburg effect is aerobic glycolysis with no oxidative phosphorylation. Learn it like this only. The sequence which I have given you, use the sequence to understand the topic. Okay, there's no need to do the further detail, you will get confused. So I repeat once again, try to understand. I need everybody's focus. It is a little tricky. So to make it easy, use the sequence which I am giving you. Okay, so let's start. Pasteur effect occur in normal cells of the body, right? It says that if oxygen is present, then anaerobic glycolysis will be inhibited. Obviously, no, because if oxygen is present, one glucose can give 32 ATPs. Anaerobic will only give 2 ATPs. So why to waste glucose? Therefore, any normal cell will do this thing that if oxygen is present, they will want to use all glucose for aerobic. So anaerobic will be inhibited, right? Fair enough. But Warburg effect is abnormal effect which occurs in cancerous cells. It says that if oxygen is present, then also glucose will form lactate. Anaerobic is happening, and always anaerobic is happening. But it is called aerobic. It is known as aerobic glycolysis. Why they call it aerobic? Because it is happening in the presence of oxygen. This kind of glycolysis happening in the presence of oxygen. But to complete the definition, we are saying aerobic glycolysis with no oxidative phosphorylation means this glucose is not going into ETC, right? So that means, can I say that each glucose will be giving only 2 ATPs? Can I say that each glucose will be giving only 2 ATPs? Now, that means cancerous cells are wasting glucose. And cancerous cells are only getting 2 ATPs per glucose. So they have, and cancerous cells have rapid growth. They have high demand of energy. They have rapid growth. They need lot of energy. But each glucose is giving only 2 ATPs, right? So they have high uptake of glucose. And each glucose only giving 2 ATPs. So can I say that cancerous cells are wasting glucose of the body? That's why weight loss and cachexia occurs in cancerous patient. Okay. So earlier the scientists were unable to understand why weight loss is happening. But when Warburg effect was discovered, then at molecular level, we have now explained that why this is happening, because cancerous cells are kind of wasting glucose. Okay. Each glucose is only giving 2 ATPs. Lakshmi, you have a doubt, ma'am, why it is called aerobic glycolysis when lactate is the end product? It shouldn't be anaerobic. See, I hope by now your doubt is cleared. So I repeat once again, like you remember, removal of oxygen is called reduction, na? Removal of oxygen or removal of hydrogen is called oxidation. Then you will say, ma'am, oxygen is not added. Why are we calling it oxidation? We do like that. In theory, we do like this. In theory, we do like this, that removal of hydrogen is called oxidation. Similarly here, Glucose to lactate formation is glycolysis pathway. It is occurring in the presence of oxygen. So it is called, just called aerobic glycolysis, but with no oxidative phosphorylation. In this aerobic glycolysis, what is the end product? In this aerobic glycolysis, what is the end product? Lactate, not pyruvate. In this aerobic glycolysis, one glucose will give how many ATPs? How many? 2 ATPs only, right? So this is a different kind of aerobic glycolysis. That's why, in short, Warburg effect is aerobic glycolysis with no oxidative phosphorylation. Yes, Ashfaq, it's good you realize that it is easy. So this way, when you do conceptually, things are so easy and interrelated. Yes, Varun, cachexia and weight loss occurs because of this molecular level effect of Warburg effect, because cancerous cells are wasting glucose of the body. Okay, Lakshmi, congratulations. You have got it now. So I'm also very happy. So yeah, what is the answer to this question? Thiokinase of TCA produces? Best answer to be marked is both. Best answer is both A and B, right? Both ATP and GTP. We know that mostly this enzyme produces ATP, and only in special situation, in fasting and starvation, it will produce GTP. Okay. So this is it with today's session. We'll meet tomorrow with amino acid disorders, that is phenylketonuria, albinism, and alkaptonuria we'll be discussing. See you tomorrow, same time, 7 p.m. Bye-bye. Good night.